Good morning, everyone. I'm delighted to be here with you today, and I wanted to thank Brian for inviting me. I'm a bit nervous because, other than stated, I'm not an expert on drugs. However, in my past track record as research leader, I've been closely involved with developing research with societal impact, pathways to engagement and impact, in particular with regard to policy development. And in giving consideration to the issues of drugs in society and the role of universities and the national research and innovation ecology in addressing the issues we face, I speak also as a parent of a son in his mid-20s by now, a president of a university and a guardian for over 18,000 students, and also the university as an agent for the communities we serve. As you all are aware, drugs are a societal issue. They pose a significant and very complex problems. For instance, in Ireland, and you see here, by the way, the European perspective, for Ireland, every year the Irish focal point to the European Monitoring Centre for Drugs and Drug Addiction, based in the Health Research Board in Dublin, compiles its annual report on the drug situation in Ireland. And I'm sure you're much more familiar with that than I am. But what is evident is that the use of drugs, of controlled and illicit drugs in society is growing. We have had an increase in death from 2004 to 2020 by 87%, from 431 in 2004 to 806 in 2020. Male have accounted for the majority of deaths in each year. More than 6 in 10 of all deaths in 2020 were male. And there's, of course, a very close link between drug misuse and social and economic disadvantage, as we all know. In looking at the European Drug Strategy 2021 to 2025, by outlining a common approach to address the security and health implication of drug trafficking and drug use, I wanted to observe that the universities with their research are very well placed in order to contribute to the further development and thinking for the evolving European drug strategy that will start in 2026. We are very well placed in terms of developing or supporting the development of policies and initiatives and measures in practice by working with a diversity of stakeholders, often in the position as an honest broker. We are very well placed in terms of our knowledge ecologies at universities by being able to bring together different disciplinary perspectives and expertise, given that the nature of the drugs phenomenon is cross-cutting and involves many different areas of insights, from sociology to criminology to psychology, medicine, but also, if you look, economic studies, etc. But also, I think, an important task, and that becomes more and more evident, is the development of innovation and foresight. At the University of Limerick, we are the first university in Ireland that has established a future and foresight role in the university that helps us to anticipate developments, to think back from the future. And our director for sustainability, innovation and foresight, Andrea Deverell, is working closely with government and the OECD to develop expertise in that area and implement it also at government level in Ireland and further afield. And of course, as universities, we all have a very strong commitment to equality, gender equality, human rights, inclusion and equity. And again, from the perspective of my own university, we've attained the first Athena Swan Silver Award in Ireland that recognizes our efforts to embed EDI and human rights in the university, and that also informs our research perspectives, research design and approaches. And last but not least, engaged research and engaged education, i.e. engagement with the communities we serve, not only for but with them, in them, lies at the core of many of our research endeavors we conduct. In terms of the key areas, and I hope that works, the key areas that the European drug strategy covers: drug supply reduction, drug demand reduction, addressing drug-related harm, and the cross-cutting themes of international cooperation, research, innovation, and foresight, coordination, governance, and implementation. Again, universities are very well networked within Europe, fostered by Horizon Europe and the previous framework programs of the European Commission, as well as the Erasmus program supporting student and staff mobility, joint program under the Erasmus Mundus scheme, and so on. So there are many opportunities to develop dialogue, the exchange and sharing of knowledge, joint research endeavors to tackle the complex issue of drugs in society from, again, a diversity of perspectives. The Minister just mentioned the citizens' assemblies on drugs, and I don't want to steal Paul Reed's thunder, who will talk about that in much more detail, but the citizen assembly that just took place on drug use made 36 recommendations. I've only picked the recommendations out here that are directly aimed at government and on policy development. And you see here the first one is introduce a health and all policy approach to policy development. Again, universities, I think, are well placed to support with their research expertise such an approach. Prioritize drugs misuse as a policy priority as part of an overall socio-economic strategy. So by analyzing the socio-economic conditions in Ireland and further afield, I think universities can contribute towards a systemic and holistic approach in doing so. Thirdly, recognize that an effective national response to drugs-related issues requires whole government policy coherence, operational cohesion, and effective leadership. Again, I think universities can contribute in close collaboration with government in a policy analysis, mapping, identifying duplication and gaps, and contribute towards that systemic and holistic approach. And 3.7, ensure effective stakeholder involvement in implementing the next iteration of the national drugs strategies. As universities, we are deeply committed to working with the universities we serve. We educate leaders, for instance, in the community. Our university hosts the Knowledge for Change Hub, which is a UNESCO-endorsed network of global training schemes for community mentors. We have developed that and built very close relationships to our communities, and therefore are able to talk not only to the community leaders but to all the members in the community in an increasingly effective way, because our relationship is underpinned by trust and by a long-term commitment. So we're not parachuting researchers in and take them out. We are committed to serving our communities in a long term. And most recently, I wanted to say that our Greentown project, led by Professor Sean Redmond, who's been seconded from the Department of Justice to the university, and with a project that focuses on children and youth crime in the community and how that can be prevented. Again, a wicked project has been supported by the Higher Education Authority through performance research funding, and that will enable us to put in place a center of research for research on policy implementation in order to ensure that we are aware of what works, what doesn't work, how agents across different government departments, different sectors can work effectively together in order to support the implementation, evaluation, review, and development of policies. And that pertains also to 3.9, again, pursuing a holistic approach, not only dealing with the people who use services and drugs, but with their families and the wider community. and in terms of the recommendations that pertains to the continuous development of the national drug strategy, the use of evidence-based approaches to harm reduction is a very important point. Again, through the development of impact and evidence-focused research approaches, we can, as universities, contribute towards views on existing measures and the development of new measures that support harm reduction in a timely manner. We can also support the evidence base in terms of innovation of services and design, given the breadth of our research across our universities. And we act not so much in competition. Increasingly, we act through collaboration, and we also work very closely across the island with our university partners, Queen's and University of Ulster in the north, as well as internationally. And I do think that we can make a significant contribution to data collection, to assuring quality of data, to the development of evaluation criteria for complex, not just for single-dimension issues, in order to support evidence-based decision-making and policy development. Looking at universities more closely, of course, being in a university, we are always, as in many other areas, caught between the legal framework in Ireland, which prosecutes the possession and use of drugs, and a public health approach that contributes or that works on the basis of health awareness, harm reduction, rehabilitation. And I think that is important to note, because we know what the impact on young people is if they have a criminal record through the possession and use of drugs. It really impacts their professional careers, and so we need to do all we can within our universities to work with young people. But I would also include our staff who have issues in terms of a public health approach, being mindful of the legal situation that we have in Ireland these days. The universities signing up or have signed up to the Higher Education Healthy Campus Charter and Framework, which follows, which aims to create a shared understanding of a healthy campus to guide and inspire actions by the higher education institution. It supports and recognizes the work of the higher education institution in improving the health and well-being of our campus communities, and it generates and disseminates knowledge for promoting health and well-being in higher education. And it is underpinned by a whole campus approach: leadership, strategy and governance, campus environment, our facilities and services, campus culture and communication, and personal and professional development. The principles underpinning this framework are participation, partnership, evidence-based, and sustainability. And why am I saying that? Because in our iteration of the Higher Education Healthy Campus framework, we have six themes that we are working on, and one is the addictive behaviors, which includes drug misuse, gambling, alcohol, etc. Again, we do that from a promotion of health awareness and education approach. We focus on harm reduction. We have appointed an officer for substance use and gambling in order to help us to develop initiatives, but also to conduct the research that assures that our interventions are successful. And that research, again, is co-created with our students, with our staff. I think that's really important, because the way in which young people are making meaning are changing, so we have to ensure that the measures, the campaigns we run are effective. We have to ensure that we take account of their experiences and so on, in order to ensure that our initiatives are relevant. And that research is collaborative. It is based on evidence insofar that we doing surveys and so on students' health and well-being that also look at the use of or misuse of drugs. And we have implemented a university substance misuse policy. In terms of the higher education, research and innovation context for Ireland, and that's the part that I would like to cover coming to the end of my presentation. We have national policy developments to mobilize higher education research for public policy development through the Research and Innovation Strategy Impact 2030, through Science Foundation Ireland's Creating Our Future Expert Committee report key recommendation of last year, and the establishment of a new evidence for policy unit within the Department of Further and Higher Education, Research, Innovation and Science. And we have the Research and Innovation Bill forthcoming, which includes the development of a national research agency that brings Science Foundation Ireland and the Irish Research Council together, so it creates a unified ensemble of disciplines in order to support cross-disciplinary research that addresses complex societal issues. The intent of these frameworks and policies is to better link public research outputs with policy formation, implementation, and evaluation. It is underpinned by the OECD. Sorry, I'm moving on my laptop rather than on the screen. It's underpinned by the OECD report, Strengthening Policy Development in the Public Sector in Ireland 2023. As well as reflecting the OECD report. And it looks at a few key points. The need for a new policy infrastructure and roles across government and higher education, strategic foresight support for policy planning, development and long-term policy, new training ecosystems based on the identification of capacity and capability needs, the engagement with citizens and the consistency of approaches across sectors, and shared and open data systems. I think it is interesting that it states that no government has a monopoly on policy ideas, and insights for policy can come from the wider policy ecosystem, especially from academia, civil society, and the public. And we already, as universities, working with the government in terms of the way in which in the commissioning of research and evaluation, we have joint research projects, for instance, like we have with the Department of Justice and the Department of Children, and we looking, as I said before, at strategic foresight. And I think universities have a pivotal role to play in building capacity and to produce research insights through their capability to build the evidence base, for instance, as we have demonstrated in our Greentown project. And I think it is really important that we use that expertise available. The universities, Irish Universities Association commissioned a report on researcher and policymaker engagement by Mazars in 2022, which was supported by the HEA, and it was a scoping exercise to better understand how education-based researchers and policy officials initiate and implement evidence for public policy. And the outcome from this report was that we need to demonstrate the opportunities that exists for policymakers and higher education researchers to work together to address societal challenges, support policy officials to draft and implement evidence-informed policy based on the best available research evidence, and build effective networks with policy officials and researchers for future opportunities. I think it is important that we look at how we can support the development of training opportunities in our own universities, but also for government officials in the departments to build capacity and capabilities, how we can support through our research to change attitudes and behaviors and cultures in society on individual, collective, and organization levels, and how we can support building an effective infrastructures and effective roles in order to support evidence-based research development, evaluation, implementation, evaluation, and review. Thank you very much.